Hi, Soph.
Hiya.
I have to say, this is very exciting. You are our first in-studio interviewee.
Amazing.
Up until now, it's all been done on Zoom. You are sat here in my kitchen with me, at my kitchen table.
Very exciting.
It is very exciting.
It is.
How are you feeling?
Yeah, good.
Yeah.
Yeah, really good.
Not nervous?
No,
No.
I'm just talking to you, really.
That's very true. We
So,
talk a lot.
Yeah.
We do. Sophie has agreed to come on the podcast and talk about her experiences. So, Soph, I'm just going to ask if you could give our listeners a little bit of context as to what you've been through and why we're having this discussion.
Yeah. So this is about miscarriages, which I have written here, like just my notes in that. Because if I had a cold or I'd had a car accident or something, or I'd get a get well card or I'd get some flowers, but with mental health you don't get that at all. And I feel like it's exactly the same with miscarriages. No one really knows how, like, to speak to you or how to make it better. People that love you want to, but they don't really know how to. So that's how I feel it ties in with the mental health, because it's sort of exactly the same, and you don't get flowers, you don't get a get well card. It's such a sort of taboo subject that it's the same as mental health. If you said to someone you were suffering with something, they wouldn't know what to say or do. And I feel like that's, at the time when you're going through a miscarriage, people aren't really sure what to say or do.
So, obviously you've been through a number of miscarriages, and I know you've had an ectopic pregnancy as well. Has there been any professional or personal help when it comes to your mental health?
No, or even my physical health.
Mm-hmm.
So with this pregnancy, I found out a couple of days after Christmas back in 2019, and I was excited, and I'd wrapped the stick up in like a present and pretended we'd missed it under the tree, and I just knew something was wrong with the pregnancy. No one really believed me, and I must have rang the early pregnancy unit a couple of times a week, and they were like, oh, it's growing pains, it's implantation bleeding, you're bound to be anxious because of the previous miscarriages, but you're fine. And then, so, because I was so like anxious and stuff, I went to pregnancy yoga one evening, and woke up the following morning and said to my husband that we're not pregnant anymore. And he said, no, you're just relaxed because of yoga. And I went to work, and there was a bit more blood when I had a wee at work, so I just drove straight to the early pregnancy unit. And I think they thought, they were a bit off with me actually, because I think they thought I just wanted a scan, because we were 9 weeks. I think they thought I wanted to try and sneak in an early scan. I said to them, no, something is wrong. And they did a blood test and a urine test and could see I was pregnant, because there was quite a lot of blood in the pot of pee. So they did do a scan, an external one and an internal one, and it was ectopic. But so that was quite hard, because I knew something was wrong, but no professionals believed me. And it's not, I didn't care so much that Finn didn't believe me, because I understand that he knew I was going to be anxious.
Yeah.
But it was the fact I kept ringing the early pregnancy unit and midwives, and I felt like I was just being fobbed off. But I appreciate I would have been anxious because I've had other miscarriages, but I just knew there was something wrong. I don't know how I knew, I just did.
Yeah.
And that time I told everybody I was pregnant. But as soon as I started bleeding, I went straight to the early pregnancy unit, and that's when they told me it's actually unknown location, because they did the scan, they couldn't find a baby anywhere, and I hadn't passed enough blood to have passed the baby, but the bloods in the urine said I was pregnant, which is why they put unknown location down as ectopic. And that was it. They just gave me some tablets and I went home. And there was no sort of support or...
Was there no, like, follow-up? Was there any, check-ins, or were you signposted to a perinatal?
No, I'd seen a poster on the wall in the waiting room, which I took a photo of on my phone, of Petals, which was like a charity. And another one called Tommy's I'd seen about on Instagram. And I'd sort of Googled and I'd phoned both of these, but there was no real answers. And then I'd seen on Tommy's you have to get referred to by your GP. I called 4 times, different 4 different occasions, spoke to 4 different sort of GPs, and none of them had any idea how to refer me to Tommy's. So I didn't even get support, mental health, or with the loss of the baby.
So you've pretty much been on your own with
Yeah.
your husband, of course.
Yeah.
Yeah.
We have been. Sometimes it feels like it's us against sort of the world. And I knew something was wrong, and I kept telling people, but sort of no one would listen. And I think that was probably the easiest because I just miscarriage because I just knew there was something wrong.
Yeah.
But it did make me the angriest because all these things you read about how bad ectopics could have been. Like if I hadn't gone to the early pregnancy that day, could it have got worse? That you hear about people having to have their fallopian tubes removed and stuff, and I just feel I don't know why no one was listening.
Mm-hmm. Do you think there needs to be better provision when it comes to anxious mothers that have been through previous bad experiences in a way that you are supported, listened to, and actually that both your physical and your mental health are being looked after?
Yeah, definitely. So the NHS do. So if you've had 3 consecutive miscarriages, so if you haven't had a healthy child in between them, so you've had 3 consecutive, they will do an early scan, about 6 weeks, which is just called a reassurance scan, and that will just make sure the baby's still got a heartbeat and the location is correct.
Mm-hmm.
So I will be offered that.
Yeah.
But I just think it's rubbish that you have to have 3 consecutive miscarriages before
you get that.
You get that. What if you only have 1 miscarriage? 12 weeks is a really long time to wait, even if you've only had 1, even if you've had 3. I just don't think that. I think, why can't you just offer everyone a 6-week scan?
Yeah.
I appreciate miscarriage is so common and so likely that it's probably not feasible to offer everybody a 6-week scan, but I just think 12 weeks is a really long time to wait. Even if you haven't had a miscarriage and it's your first child, it's an anxious time.
Yeah, and I think if you're already prone to anxiety and being fearful, that there needs to be a reasonable adjustment there. If you are, your mental health is already at risk. Yeah. That there should be.
I think 12 weeks. And so also keeping it a secret, because some people do keep it a secret, and this is where I think it's really bad. Actually, is that you're supposed to keep it a secret. So if something happens, just brush it under the carpet. But actually, if something happens, you want to talk to somebody about it. So the first time I was pregnant, we didn't tell anybody. I don't think anyone knew until after we'd been to the 12-week scan and we're told no heartbeat. And then I found that really hard, having to tell like my mum and Finn's mum that we were pregnant and we're now not. And we're going to have to go into hospital and have medical miscarriage. That was really hard. So the second time we told everybody. And actually what is hard is telling people that you're not, regardless. Regardless if you've just told them 5 minutes ago that you were. It's just telling them that you're not anymore. That's generally just the hardest part. So there's no rhyme or reason if you do or don't. It's your preference. I just think you need to break that taboo of don't tell anyone until 12 weeks in case something goes wrong. But the people you're likely to tell before 12 weeks, you're likely to tell if something went wrong.
That's a really interesting point you brought up, because I'm not a mother, I haven't yet been through that process, but you do hear that 12 weeks is when you should wait, and maybe we need to break that as a norm.
Yeah, definitely, because...
Does that not put an additional pressure as well on you? Cause
so you're not well, or you're drinking decaf tea, or you're not having Pepsi Max because you're pregnant, or you're having to lie to friends why you're not having alcohol. And you have to attend these events and be, I'm driving. Are you? Didn't see the car. Look, all this. Because you can't just tell them, but they would be probably the first people you would tell if you were having a miscarriage.
Because in the grand scheme of things, is the world going to end if you tell someone before your 12 weeks scan? No. So your advice would be to people.
It's your because maybe not put it on. I don't know. Don't put it on Facebook, but tell the people you would want the support from if you were then having a miscarriage. Because then they know you're pregnant, and then they might actually be able to look out for you. And they might be able to, I don't know, just check in every now and then, especially if you've been through miscarriage. I think talking to somebody who it would just help.
So if you had any advice for women that have either already been through a miscarriage or several miscarriages, or a woman that is particularly anxious about becoming pregnant because of that, what would you say? What would your advice be?
Yeah, I don't really know. I would say if you've had one, maybe two consecutive, I would just really be quite forward of your GP to get them to do a blood test, to get them to see why. And that's the problem, is they still don't know why I keep miscarrying. I've had all these blood tests and I've had high cosies and sperm analysis and things, and that doesn't help. I don't know if the babies have all been too little to do tests. There's no. Sometimes I'm such a person that I need answers to things.
Yeah.
And there isn't any, and it's almost like no one even really cares either. It's like, well, this has happened. You'll get over it. Try again, and it's not really that easy.
No.
It took me a long time to want to try again. And I was very physically unwell for a while after my first one. My body just wouldn't reject the baby. So I was in hospital from the Tuesday to the Saturday. And just on so many drugs, and I just wouldn't bleed. Every time I went for a wee, I had to keep it in a pot so the nurses could check. And I just didn't pass it till the Saturday night when they sent me home, and I went to my own bed. And as soon as I sort of drifted off, I did then. But then I've had a bath, and you're not allowed to bath. So I caught an infection, and then I had antibiotic, and it was just, I felt like everyone treated the physical symptoms, but no one treated how I felt about it.
Yeah.
But I do just think, beg your GP for blood tests and answers, really. And actually, I personally believe acupuncture massively helped me get pregnant. So after having 3 sessions, so one a week, but only 3 consecutive sessions I got pregnant after 3 sessions, after trying for 17 months since the last miscarriage. So I found, and that was privately, acupuncture. I'd read something about it, so I definitely think that helped. It can't just be a coincidence after 17 months of trying, nothing happening, not even falling pregnant. Because then that has its own anxieties. We've been pregnant, but we now haven't been pregnant for 17 months. What's wrong now?
Yeah.
So that's when we tried acupuncture, and I was pregnant after the third one.
So what's your next step? Where are you now in this journey?
So we are waiting, because I don't ovulate, and my periods are quite irregular, and I have blood tests every 21 and 28 days. So our next step is I'm waiting for the nursing team to give me a call to have these injections to make me ovulate, and I'll have 3 cycles of them, and to see if they have made me ovulate and if I've fallen pregnant, and then we're just going to have 3 cycles and then sort of go from there. We've had informational sessions about private IVF. We're waiting to hear back if we're eligible for Essex IVF. I don't know what the criteria is, so we're waiting, just sort of waiting. I feel like that's you spend all your time waiting for them to ring you back. But so I've actually ever been to 1 scan throughout all my pregnancies. I just found the sonographer who did the scan was just very matter of fact.
Yeah.
She just said the baby had no heartbeat, and she wanted to go and get a second opinion, so she left the room for a while. While they went and got another midwife, they did an internal scan to confirm no heartbeat. Then they put us in this is all pre-COVID, so they put us in this little room on the side, and they were like, a nurse will be allowed to speak to you in a bit. And I couldn't tell you how long that nurse took to come, because it's literally the last thing in my mind. And she came in, and I just wasn't listening to anything she said, because all I could think about was that my baby had no heartbeat. And she was throwing all these options at us, and we were like, can we just go home with a leaflet? Like, we just can't take this in right now. But it was just, I felt that was so cold. I don't ever remember anyone sort of just saying, are you all right?
Yeah.
Or how do you feel? Or it was all just medical. This is what you have to do now. You can have medical miscarriage. You can wait for your body to naturally pass it. These are your medical options. Yeah. But I felt there was no emotional support options.
No, and no signposting you to
No.
people that could help you with that.
No, I had to use my own initiative and take a picture of these charities off the board, of the flyers, and try and ring them myself. And constantly and I've left messages and emails, and no one's rang me back. So I've sort of just given up, really. And I'm just on forums on social media where I don't say anything, but I just watch everyone bitch about things. And it just is nice, but but that's it. There's not been any sort of support, and and that's where I wouldn't say it was a mental health issue, but I've come on your podcast because I feel it's such a taboo subject, which as is mental health, I feel like they're treated the same.
But I think you've raised some really good points with, in regards to mental health, as in the lack of provision, the very matter-of-fact way in which you've been treated, and the fact at no point throughout this whole process you have been pointed in the direction of emotional support.
No.
I think that's very concerning, and I think it is appropriate to this podcast because it is all about living with, mental health in various capacities, whether it be long-term mental health or mental health declines because of a situation you're going through and a lack of support. Yeah, and I really want to break the taboo of miscarriages. I feel it is vital because if we're going to improve things for couples who lose a baby, no matter how early the pregnancy is lost, so I've gone to 12 weeks, 9 weeks, just sort of 5 weeks. I just don't feel, however early the loss is, a loss is a loss. And you sort of lose all your hopes and your dreams of the future with that baby. And pregnancy after multiple losses is just so hard. And starting treatment to help you get pregnant is scary, and there's just no sort of support or Is there anything else you would like to say to any of the women out there that might be going through similar? Just persevere, really. That sounds rubbish, I know, but there isn't I don't know what you can do to get support because I've not got it. Yeah. So it's not like I know what the answer is. You just sort of, I don't really have an answer. And that's absolutely fine. And I do remember thinking that bleeding out at home would be much easier. And then I had a second miscarriage, and that was obviously famous last words. It isn't any easier to bleed out at home early on. From the day you read the pregnancy test is positive, you're buzzing. If it's something you want, you're so excited. You're a mum. Yeah. And you're so excited. And then when you bleed at home a week later, it breaks your heart because no one knew about that either, or any of the professionals, because it was literally probably a week after the positive. So you're just trying to get all my thoughts together. This was our second one. And I just bled at home a week later. And so that was so soon after finding out that I'd been pregnant. It's sort of just a roller coaster of emotions. And I obviously hadn't got around to sort of telling anybody. Yeah. I would just persevere with the GP and trying to get answers. So I'm very comfortable talking about it, and because it is such a taboo subject, and I feel that there should be more support there, and I really want to do something. I don't know what, but I really would like to do something to help women, because if you already have an underlying mental health issue, and then you go through this, and there is no support, I don't know, that must be so hard. To go through this anyway is really hard, without any underlying issues. And I don't know where you get the support from, but I just don't think that's okay. And like I said before, the 12-week scan, I think that's a long time to wait for somebody who might have anxiety or I don't know. And I don't know what with post depression and things. It's just I don't know. Yeah. Being a mum without a baby is awful. So I just want to say a massive, massive thank you for coming on the podcast.
No, thank you for having me.
I am super proud of you. I could see how difficult that was at times.
Yeah.
There was some hyperventilating. There was a lot of drinking water. So I'm very proud of you, and I think you should be very proud of yourself for talking.
Thank you.
And I think, you said you want to do something. I would pursue that if you feel like you can make a difference. I mean, you just coming on this podcast and sharing your experience, you were going to make a difference to someone. Someone's going to be listening to this and think, oh my God, that that's what I'm going through. Or someone might be listening and think, I can help her. I know, there are things that we can do. So I would pursue that. And again, I'm super proud of you.
Thank you. Thanks for letting me be your first in-person
interviewee.
Very exciting. Yeah.
So just to give our listeners a little update, I am here with Sophie again, a few months after our first conversation, and Sophie has an update for everyone. So Sophie, I'm going to pass over to you, and could you just let us know where you are in your journey?
Yes, so I am currently 17 weeks pregnant, which I did know when we last recorded that I was, but because of everything we'd been through, I was waiting till the 12 weeks to keep it secret. So that was also, the last podcast was quite tricky to talk about being pregnant and talking about all the miscarriages, but was keeping it sort of a secret. Yeah, we've had 4 scans and I'm 17 weeks pregnant. And then on Saturday just gone, we had a gender reveal. We had a private scan. So we didn't know the sex either. The guy did the scan and he knew what the sex was, and he then handed us a cannon. So we went home with all our family and things and pulled the cannon, and blue confetti went all over our garden. So we're having a boy.
Oh, I have to say, obviously, when we last spoke, I already thought you were incredibly strong, being able to speak about your experiences, but then to later find out that you were pregnant at the time, but too terrified to tell anyone, because just in case you lost it again, and then talking about your losses while being scared about another loss. That's
this current baby,
That's so incredibly strong, and it's no wonder you were so nervous and emotional and all of those things when we spoke last time. So it's just congratulations.
Thank you very much.
I'm sure all of our listeners will be so happy for you. I'm so pleased. We've come so far from our last conversation.
Definitely.
So very far, and you haven't welled up once in this one.
No.
You've just been smiling the whole time.
Just smiling, it's all just a bit surreal, to be honest. I had sort of secretly given up hope, and we had IVF conversations and appointments with Cambridge IVF, and so I don't know if it was that, was it plan B? I don't know if that was at the back of my mind, or if it was acupuncture, but we weren't sold on IVF because all they would do is put the embryos in me, which is what we've done. We've been pregnant. They can't then guarantee it progresses. And that's the bit we wanted the help with.
The progression.
The progression bit. we could get pregnant. But and then actually really funny, when we were walking back from the midwives after the 16-week appointment where we'd had the heartbeat, Cambridge IVF rang to say, oh no, it wasn't Cambridge IVF, sorry, it was just the NHS rang to say, we've got some ovulation enhancing drugs for you. We'd had that appointment before I was pregnant. I was like, 16 weeks later, thank you. I was like, I'm good, thanks, I'm pregnant. And they were like, okay.
Oh my God.
So, but I am generally I cannot thank acupuncture enough. I wrote them a lovely review. I sent them flowers. We've been trying for 4 years, and it's the only thing really that different. We've been in the same house. Everything is the same, apart from, acupuncture. So,
well, I'm glad you found something that's worked for you, and that obviously.
Thank you. Yeah, I hope everyone try and find what works for them.
Yeah, and I hope some of our listeners do take away from this with some hope, and maybe get some reassurance that they're not alone, and that there are women, the world over going through this.
Yeah, definitely. You don't realise how common it is until you talk about miscarriage, everybody knows at least one person
Yeah.
that's had one. Everybody, but no one really talks about it until they're going through it.
Yeah.
So, yeah, it's strange. And then you're like, wow, more people have had more, and it's really.
And if more people started actually talking about it more openly, maybe women wouldn't feel so alone during that period, or like they can't talk to people about it.
And the only other thing is you have to have 3 consecutive ones before the NHS or the hospital or anyone will look into why.
Mm-hmm.
And I think 1 miscarriage is enough.
Yeah.
Let alone 3 consecutive miscarriages before the hospital, the doctors or anyone will look into why this is happening.
Yeah.
And I think 3 is too much.
It's a lot for a person to go through before getting any answers or help.
Especially if you have a miscarriage and then a healthy, lovely baby and then another miscarriage, that's not consecutive. You then have to have 2 more.
Wow.
But you could have a miscarriage, then a lovely baby, then a miscarriage, then a lovely baby, and you'll never know why. So, yeah, that's what if anything, that is what I'd like to change. 1 miscarriage, you're looked into.
Yeah.
And it might just be because your body doesn't know what it's doing and it's all new and your body is just not knowing what to do with this baby. But
it would give women an answer for next time, wouldn't it? It would give them some reassurance one way or the other, because if they're going to need help, they'll get the help earlier, hopefully. And if it was just a case of the body wasn't ready, they know it's not actually
their fault.
Yeah.
Because you will blame yourself and you'll be like, oh, did I have a brie sandwich? Did I eat that cranberry? Did I have too much coffee or too much tuna? You will blame yourself, even though it is not your fault. You will blame yourself. And like I said, we've been trying for 4 years, and we only got the phone call last week that we were going to be given some injections to make me ovulate. 4 years. So that's a long time. If we were seen after the first miscarriage back in 2018, we would have probably got help sooner.
Yeah.
So that's all I really want to do, or I want to come out of this, is women get help sooner.
Yeah.
Which I know the baby charity Tommy's is trying to do, because they obviously agree and they don't think women should have to have 3. So yeah. So hopefully something happens soon.
Yeah, absolutely. Well, thank you, Sophie.
No, thank you for seeing me again. Thanks very much for having me.
You're very welcome. And I'm sure our listeners will be really happy to hear this.
Thank you. Hope so. And I know it's hard to hear when you're like trying to conceive, like, oh, baby announcements broke my heart, which is why I didn't really do any social media announcements. I just did maybe a little hint or a mama t-shirt, and then we put an Instagram picture up and people were like, why have you got a mama t-shirt on? Or yeah, because I know how hard it is to see baby posts when you're trying. So we haven't really put anything on online really. So yeah. But no, thank you very much for seeing me again.
No, thank you, darling.
So yeah.